Good afternoon. My name is Kathy Hickey, and I am the Information Specialist at the Federation for Children with Special Needs. Welcome to Family Voices webinar entitled Social Security Disability. We're so glad you're able to join us. I'd like to give you a little background on the Federation for those who are new to us. The Federation for Children with Special Needs started in 1974 by a group of parents who were part of a coalition that pushed to get the first special education law in the country passed. The Federation provides information, support, and training to families whose children have special needs, special health care needs, and children who are at risk culturally, linguistically, or economically. Helping families access and advocate for quality health care for their children with special health care needs is just one of the Federation's many projects. I will be facilitating the webinar today. This webinar will be recorded and archived at a later date on the Federation's website. A few technical pointers. Please be advised that everyone will be muted except our presenter. If you have any questions, please use the webinar toolbox that allows you to type in questions, and we will answer them either during the presentation or I will collect them for the question and answer portion of this webinar, which will follow the presentation. Our webinar today will be presented by Kristen Alberino, a Metropolitan Public Affairs Specialist for the Social Security Administration. Welcome, Kristen, and thank you to our IT Director, John Sullivan.
Thank you so much. Good afternoon, everyone. Today I will be discussing an overview of Social Security disability programs. Social Security has three types of disability programs. We have Social Security benefits for workers, Social Security benefits for disabled children who have been disabled prior to age 22, and we also administer the Supplemental Security Income Program, or SSI. These three programs are very different, and I want to make sure that everyone is clear on the differences between these three programs. As we know, as we work and pay into Social Security, we are working and earning credits so that if something was to happen and we became disabled prior to reaching our retirement, we could possibly get Social Security disability insurance. So you work and you earn credits, and that's what SSDI is, Social Security Disability Insurance. If you work, you pay into Social Security, and you become disabled, you may be entitled to that program. Then we have Social Security Disabled Adult Child Benefits. What this benefit is referring to is if a person is receiving benefits either from Social Security Disability or Social Security Retirement, and they have a child who is disabled before they reach the age of 22, they could potentially get benefits off the parent's record. And that is what Social Security disability, adults disabled since childhood, is referring to. And then last but not least, we have the Supplemental Security Income Program, or SSI. SSI is different from the other two programs because you don't actually have to work and pay into Social Security to become entitled to this program. SSI is a low-income, low-asset program for children or adults with disabilities or folks that are age 65 and older. Unlike the Social Security Disability Insurance or the Disabled Adult Child Benefits, SSI comes from general federal revenue, not the Social Security taxes that we're paying into. Now, for Social Security Disability Insurance, in order to qualify, you need to have a recent work history. So, in other words, when you work and you pay into Social Security, you earn Social Security credits. Once you hit retirement age, if you have 40 credits, you will get your retirement benefit. But not the same applies for Social Security Disability Insurance. There needs to be recent work. If you are age 31 and older, you need to have 5 out of the last 10 years working in order to qualify. So this slide shows you what the work requirements are. Again, age 31 and older, you need to have worked 5 out of the last 10 years. But for a younger worker, they need to have worked half the time since age 21. So in other words, for someone who becomes disabled and they're age 24, they only need a year and a half of work prior to becoming disabled. And if you were between the ages of 24 and 31, you need to have worked, again, half the time between age 21 and the time the disability began. But in all cases, there needs to be recent work. If you have not worked and paid into Social Security leading up to your disability, then you may not qualify for a benefit. Work credits. Social Security, every year there's a new amount determining what a work credit is. For 2013, that amount is $1,160. So that's all it takes in order to earn a Social Security work credit. For Social Security retirement, once you have 40 credits and you can earn 4 of these per year, you are qualified for a retirement benefit. And again, Social Security disability insurance works the same way. You work, you earn Social Security credits so that at retirement, or if you were to become disabled prior to retirement, you have that benefit available to you. Now, in order for Social Security to determine whether or not a person is disabled, we are looking at, and this is for an adult, age 18 and over, we are looking that the person has a physical or mental impairment or a combination of both that is going to last at least 12 months and is going to make them unable to work substantially. And we're going to talk about what Social Security considers substantial work later on in the presentation. In order to determine whether or not someone is eligible for Social Security disability insurance or SSI, we consider age, education, and the person's past work activity. Social Security benefits for adults disabled since childhood. Again, just to reiterate, this would be due to a child, this benefit, once their parent is on the rolls for Social Security retirement or disability benefits. A lot of times, a person is entitled to disability insurance or retirement benefit. If they have a child under the age of 18, they will be getting a Social Security auxiliary benefit. What will happen is when they are approaching the age of 18, that benefit is due to stop. So we will send a letter out asking, does your child have a disability? If your child does have a disability, we will continue the benefit, and that would be the disabled benefits for adults disabled since childhood. So again, this would be somebody is still working, paying into Social Security, and there is a child who is disabled prior to the age of 22, and they can receive a benefit on their parent. Now, once a person is eligible for Social Security disability insurance, they will be automatically enrolled in Medicare after being entitled for disability benefits once they've been on the rolls for 24 months. So on the 25th month, they will receive a letter that says that we are signing you up for Medicare. Now, if you are an adult and you have a spouse and you're getting coverage from your spouse, or you have a child who can get coverage from the parent, you do have the opportunity to say no, you do not want Medicare. Because the one thing to keep in mind is that Medicare is not free. This year for 2013, Medicare costs $104 per month. If a person is eligible for Medicare and they decided to take it, and they are also eligible for Mass Health will come and they will pick up that $104 per month. So a person in that circumstance would absolutely want to take Medicare because they would not have to pay for that premium. But some folks do get that letter and they decide that they do not want to take Medicare because they have a spouse that is entitling them under their health insurance through work. Okay, now on to SSI, or Supplemental Security Income. Like I said, this comes out of a completely different pot of money from the Social Security Disability Insurance Program. SSI is for people who have very limited income, limited assets, who are blind at any age, disabled at any age, or age 65 or older. What we're talking about when we're talking about assets and the resource limits, and these amounts have not changed, I don't think, since the inception of this program in 1972. But if you want to see if you are eligible for SSI benefits for an adult, they are not able to have assets that exceed $2,000. $3,000 if we're talking about an adult couple. When we're looking at someone being below $2,000 in assets, we're looking at bank accounts, we're looking at a second vehicle, CDs, IRAs, stocks, bonds, 401ks, anything that is liquid, anything that you can obtain and use. The way to think of the SSI program, it is a last resort program. So it is something that you have already depleted your resources before you can become entitled to SSI, or an adult can become entitled to SSI. So the one thing we do not count towards the asset limit is the home in which you live in. We exclude one vehicle in the person's name. We exclude any burial plots. And sometimes we can set aside assets for burial. So I'll give you an example of that. If a person comes in and applies for the SSI program and they have assets that are over $2,000, possibly, let's say, in the bank, they may be able to take out a certain portion of that money, up to $1,500, put it into a separate account, and sign something with the Social Security Administration saying they are only going to use that for burial. And what will happen is, this is getting the person under that $2,000 asset limit, and Social Security will monitor that other account to make sure that no money is being taken from that account. And that would only be in cases for assets set aside for burial. It would have to be a separate account, and during Social Security's SSI reviews, we'd make sure that no money has been taken out of that account. If somebody decides to do this, it's very important that you do not take any money out of that account, because it will be explained to the person that if they had, then that would go all the way back, that you wouldn't have been eligible from the beginning. But it is interesting to note, and we do have some people that do set aside assets for burial, and that will make the difference as far as getting them entitled to SSI. So SSI for adults, there's also SSI for children. When we are determining eligibility for SSI for child, we are looking at the income and assets of the parents that are living in the household of the disabled child. So we have different income and asset limits for children. The resource limit for a child is $4,000 if they're living with one parent, $5,000 if they're living with two parents. If there is a child that is either in the custody of a relative or maybe DCF, the resource limit is back to $2,000 as if they were an individual. We are no longer looking at the income or assets of the parent. And it's important to note that we're only looking at the income and assets of the parent that is living in the household with the child. And again, we count all bank accounts, CDs, IRAs. We do count a second vehicle, stocks, bonds, 401ks. Again, anything that is liquid, anything that can be turned into income. We also take into account toward the asset limit or resource limit life insurance policies. If you have a life insurance policy that has a cash surrender value, that cash surrender value will go towards the resource limit. If you have a life insurance policy that does not have a cash surrender value and there's no liquid money that you can obtain from the life insurance policy, then it would be excluded. Now, when we are determining disability for a child under the age of 18, we are looking that they have a physical or mental impairment or a combination of both that results in a marked and severe limitation in functioning. The condition, again, must be expected to last at least 12 months. The important thing to note about this is there are different rules for an adult as opposed to a child. So a child's disability, the way that they're figuring whether or not the child is disabled is different from an adult, because as an adult, as we discussed, we're looking at work history, education, and those sorts of things. So the point I want to get across to you is that if you have a child who qualifies for the SSI program, once they reach the age of 18, Social Security now needs to make a decision about whether or not they qualify under the rules as an adult. So when the child reaches age 18, We are no longer counting the income and asset limits of the parents, because at that point we are considering them an adult and we are only looking at the income and assets that are in that person's name. If the child continues to live with the parents but doesn't pay for food and shelter, a lower SSI payment may apply. The reason for this is because SSI is a last resort program. There are different amounts for a person who is living with friends or relatives where they do not have to contribute to the household expenses, or they are unable to contribute their share of the household expenses. In that case, the SSI payment would be lower than a person who lives on their own, has an apartment, and they have rental liability, and therefore the income that they need, it does go up for SSI because they do have the bills to pay, and that's their primary responsibility. So again, when the child reaches age 18, if you have a child who your income and assets made them not eligible for SSI, once they reach the age of 18, your income and assets do not count, and at that point, you may want to apply for your child or reapply for your child. If you have a child who is already receiving SSI, once they reach the age of 18, Social Security needs to make a new disability determination. And what will happen is you will get a letter in the mail. It says that we need to do a medical review. We will speak with you. We will send you a few forms to fill out that is basically asking you of any new doctors, any new medications, any new tests, updated school information, anything that is relevant to this child's disability. And we will send it to the Mass Disability Determination Services, at which point they will try to find that child who is now an adult eligible to continue their SSI. Once someone qualifies for SSI, they are automatically eligible for Medicaid or Mass Health. So that is automatic from the month that the SSI begins. Once we have a favorable disability determination, the Mass Health will kick in for SSI, unlike Social Security where the person has to wait 24 months to be eligible for Medicare. When you apply for Social Security disability benefits, or SSI, we're going to ask you as the parent, if you're filing for a child, to describe the disabling condition, give us information about where you've received treatment for the disability, information about medication, information about education and any work history, and we will then ask you to sign a medical release form authorizing us to obtain your medical records. To apply for benefits, there's three parts, whether we're applying for Social Security disability insurance or you're applying for SSI. You need to complete an application. For Social Security disability insurance, you are able to actually complete the application online at socialsecurity.gov. For the SSI program, because there are a lot of questions regarding income and assets and who you live with and what your living arrangements are, that application still does need to be done with a Social Security representative. So regardless of which disability program you are filing for, an application needs to be taken. It really doesn't take too long. The part that is the most time consuming is the disability report. If you are filing for a child or you're filing for an adult, the disability report, they are different, but both of which can be found at socialsecurity.gov. You can complete these disability reports online and submit them and have them ready at the Social Security office for a representative to review. And then you can finish up either the SSI application or the Social Security disability application with one of our representatives. Last but not least, the last piece of the application process is that medical release form, or the SSA 827. The SSA 827, if you are filing on behalf of your adult child for SSI benefits, they need to sign the medical release form. So you do not want to sign the medical release form on their behalf. You would have, even if they're just reaching age 18, you want them to sign it. If they're unable to sign it, based on, because of their disability, they can actually mark with an X or make a mark, and you as the parent, you can actually witness. There is a witness block right on that medical release form. So again, what you can complete online is the adult disability report, the childhood disability report, and you can actually electronically sign that medical release form or SSA 827. It really is advantageous to complete those disability reports online. Again, that is the most time-consuming process regarding filing for Social Security disability or SSI benefits. We are finding that if you go to socialsecurity.gov and you at least complete these disability reports online, we're finding that we're getting a much better product. We are getting updated information. You can go online, you can take your time, and if you cannot complete the disability report during your first session, you actually have the opportunity to get a reentry number. So you can stop, come back to it later, you go in with your reentry number, and you can finish up the disability report. That's really nice because if you're going to appointments or need to verify an address or a test that was done or a medication that was given, then you can take your time and you can make sure that by the time Social Security receives the disability report, you've really told us everything that we need to know to make an informed decision. Again, the authorization to disclose information, or the SSA 827, gives us permission for healthcare providers and others to release records to Social Security. At the end of your online disability report, you'll have the opportunity to electronically sign and submit the form. However, if you are helping, again, your adult child apply for SSI or Social Security disability insurance, they are the one that is supposed to be signing, whether it be electronically or pen and ink signature. So it's important to note that there's a question right at the end. Are you the person filing, or are you assisting someone in filing? So you can electronically sign, but that would be in the case where you're assisting someone, or they are actually filling it out for themselves. Another option is to print the medical release form, sign it, and mail it to your local Social Security office. Anytime you apply for Social Security benefits online, Social Security is mandated to pull in your applications within 5 days, review them, and contact you to either make an appointment so that you can finish up your application, or contact you because we need further information. So signing that medical release, that typically is the reason in some cases why it takes a little bit longer to get it over to the Mass Disability Determination Services to make the medical decision, because of the mailing time of this medical release. So keep in mind that that is an important piece. If you want, you can print it, have your child or yourself sign it, depending on who's filing, send it right to the Social Security office, and at that point we should be able to send it off to the Medical Disability Determination Services. So again, SSI, you complete the disability reports online, but unfortunately you cannot complete the application. That has to be done with a Social Security representative. So if you go on to socialsecurity.gov, you complete the disability report, you can call our 1-800 number at 800-772-1213, and you can ask to have a telephone appointment with one of our representatives to finish up or complete the SSI application. If you've already done the disability report online, it will already be with the representative at the time of your telephone appointment. So the only piece of it would be asking your questions and doing that application. Once we have that with the medical release form, we can send it up for a medical decision. Okay. So what happens next? Social Security will forward your application to the State Disability Determination Services. They will contact your medical providers, and if they do not have sufficient information or there's a missing piece of the puzzle, they will ask the applicant to see possibly one of their doctors. They will actually pay for that appointment and provide transportation. So disability determination services may also ask you to provide additional information or complete additional forms. So it's very important that once the application process has started and it's at the disability determination services to get a decision, that you're following up with all your mail and seeing what additional information they may need. If adequate information is available, disability determination services will make a decision. And again, they may ask you to have a special exam at our expense. A lot of times people are being denied because we don't have enough medical information. We've asked them to go see one of our doctors and they missed the appointment, or they didn't get their mail. They didn't see that they had an appointment coming up with one of our doctors. So that's a very important piece, that if that appointment is made and you were unable to make the appointment, that you do reschedule it. If the claim is allowed, you will get an award notice. The award notice will tell you when your benefits are going to start, how much you will receive. It will go over your reporting responsibilities regarding working, or if the disabling condition gets better. It will also talk to you about when your case will be reviewed. For SSI, we do not only medical reviews, but we also do non-medical reviews every year. For Social Security disability insurance, there's only a medical review. So the medical reviews happen either every year, every 3 years, 5 years, 7 years, depending on what the disability is. And that would be an opportunity for us to get updated medical information. So that award notice will tell you when the medical review will take place. Now, if the Social Security or SSI claim is denied, you'll get a letter explaining the decision. It may tell you what medical evidence we used in making our decision, and it will tell you that you have 60 days to appeal, and you absolutely want to appeal these decisions. We do see these things get turned over all the time. If your application was denied, you just go to socialsecurity.gov, and on the left-hand column, you'll say File an Appeal. The only thing you will need in your position to file the appeal is that denial notice, because it is going to ask you the date on the notice so that we know that your appeal has been filed within the 60 days. Once you've filed your appeal online, again, it goes right to your local Social Security office, but it locks you in and it gets that process started right away. Just like the initial application, an appeal does ask for updated medical sources, tests, medications on a disability report that can be completed online as well. Really and truly, the best and easiest way to file an appeal is online. It's simple, and it immediately goes to your Social Security office, and you know that you've done it. You get a receipt right through your email saying that the appeal has been filed, and that you will be it's going to go back up to the disability determination services to a new person to make a decision. Just back to appeals for a second. There are two different levels of an appeal. The first level of an appeal is a reconsideration. The second level of an appeal is a hearing. For the reconsideration, again, you file your appeal. It goes back to the disability determination services, where a new examiner is going to reevaluate your evidence that has been sent to your file and possibly ask you to see another doctor or a new doctor, or complete new paperwork. If that's denied, again, you'll get a letter. You have 60 days to appeal. The second level of an appeal is a hearing. A hearing could take up to a year to actually get a letter that tells you the date your hearing will be. So it's important that as soon as you get those denial letters, you are filing an appeal. And again, we see these things overturned all the time. There could be some piece of evidence or something that we're missing in order to get the child or adult entitled to a benefit. So it's important to appeal, and it's even more important to do it timely so that you can basically get in line for your hearing and hopefully get you a quick determination. Okay, so I want to talk to you about what happens when you are entitled to SSI or Social Security and you want to go back to work, or the child wants to go back, or wants to get a part-time job, the adult child. Social Security when we're looking at whether or not you're eligible, we're always looking at whether or not you are able to work substantially. And substantially is a money amount. And for 2013, that's $1,040 per month. So that's called substantial gainful activity. If you walk into a Social Security office and you are working and you are making $1,040 per month or more, at that point you may not be eligible to receive Social Security or SSI, because according to Social Security rules, that is substantial work. However, that $1,040 a month, if you are earning that or more, but you have income-related work expenses or a subsidy, then it might bring the earnings down under that $1,040. An income-related work expense are any medical items or services that enable an individual to work, such as maybe co-payments for prescriptions, some sort of device that the person needs in order to work that they had to pay for, doctor's visits potentially, any item or service because of the impairment, physical or mental, that is allowing the person to work, and without it they would not be able to work. That is what we are referring to when we're talking about an income-related work expense. Subsidy could also bring down the amount of work under the SGA or substantial gainful activity limit. A subsidy is talking about when an employer is paying more to the person than the value of the individual services. So maybe a person is doing a job, but because of their disability, they need extra help or assistance. They require extra supervision, working at a slower rate, or maybe they're only performing certain tasks of the job that someone without the impairment would have additional duties or tasks. So that would be a subsidy. How Social Security figures out whether or not there's a subsidy is by sending a questionnaire to the employer, just asking, does this person, although they're working and you enjoy having them on the job, are they working possibly at a lower level of work? And that is only to the person's advantage, especially when we're talking about substantial gainful activity. If there is a subsidy, then that could be the difference between a person working over that substantial gainful activity amount. So you always want to keep those things in mind. If the person is working and there are some work expenses that are coming out of pocket, or there could potentially be a subsidy, that could get them under the $1,040 and potentially qualify them for Social Security or SSI. When somebody is receiving Social Security disability insurance, as opposed to SSI, there are different rules regarding what kind of work you can do and how Social Security counts the work. So first, I just want to do a brief overview of the Social Security disability insurance and what happens when you go back to work. If a person is eligible for Social Security disability, they are automatically given what we call a trial work period. The trial work period is for 9 months, and a person is guaranteed that for 9 months, no matter how much they make, they will keep their Social Security benefit and health insurance. The 9-month trial work period do not have to be consecutive, but every time they earn over $750 for the month, they used up one of those trial work months. So they have 9 months. Again, they don't have to be consecutive, so if a person goes back to work and it's only for 3 months and then the job doesn't work out, they've only used 3 months. And then let's say 6 months later, they get a new job and they start working, they will start using, again, a few more of their trial work period. So for 9 months, the person is guaranteed that their Social Security benefit will remain. Once the 9-month trial work period has been used up, the person enters what we call an extended period of eligibility for 36 months. So you can think of it as the person is working, they've used up the trial work period, but for 36 months we're keeping their case open. And as long as they're working under that SGA limit that we just talked about, they can continue to get Social Security benefits. For the months that they go over the SGA amount, they will not be entitled to a Social Security disability check. And again, this is only for Social Security disability, not SSI. This is how it works for the Social Security program, and for people going back to work. So for 36 months, every time they work over SGA, they would not be entitled to a payment. If they keep it under SGA, then they will be able to work and collect their Social Security benefits. So now we're at 93 months. That is a work incentive. You know, we're going to guarantee you Medicare. We're going to guarantee you your payments if the work does not work out for 93 months. After the trial work period ends, if the impairment continues to be disabling, Medicare will continue up to 93 months. Okay, so now what happens when a person works while receiving SSI? This is a little bit easier to explain. When you are receiving SSI and there's income, SSI, unlike Social Security, has one set amount. And for 2013, the federal amount is $710 per month. When a person is working or receiving any other type of income, that $710 is subject to go down. So for right now, I just want to talk about what happens to the SSI payment when a person goes back to work. Basically, there is some incentive to a person getting SSI and going back to work. In this example, the person receives $1,000 per month in wages. And we basically take $1,000, we subtract $85 as if it doesn't exist, and then we divide the remainder by 2. So in this example, after we've done that math, there's $457.50 that will be subtracted from the SSI amount. So this person, in this example, gets wages of $1,000 a month, but their SSI is only going down by $457.50. So this person ends up getting $252.50 from SSI plus $1,000 per month. So, you know, at the end of the day, they end up with quite a bit more income had they not gone back to work. So unfortunately, a lot of people feel that if they're on SSI or Social Security, they are not able to go back to work. As you can see from this, they can go back to work, and it's in their benefit to do so. Of course, if they continue to work and they go over to the point where their SSI payment goes down to 0, then they would just continue to work. However, if the payment goes down to 0 and the reason is because of wages, there is continued Mass Health or Medicaid eligibility for up to a year. So when a person is receiving SSI and they get a job and the SSI payment goes down to 0 and it's because of wages, then Medicaid will continue for up to a year. If the SSI payment goes down to 0 and then the job doesn't work out, it is very easy, as long as it's within 12 months, for Social Security to reinstate a person's SSI. It could be just you calling the Social Security office and letting us know that the work has stopped. As long as it's been only within 12 months that the payment has been at 0, it will be very easy for us to reinstate the payment. Plans for achieving self-support. This is a really great work incentive to folks that want to go back to work. PASS, or Plan to Achieve Self-Support, is a work incentive program for people who are receiving SSI and their SSI payment is going down either because of earned wages or unearned income such as SSDI or unemployment or child support or whatever the case may be. What PASS is, it's a written plan for the individual to reach a specific job goal. So if a person has a job goal in mind, they have the opportunity to write up a PASS plan, have a PASS specialist with the Social Security Administration review their plan and see whether or not they will provide them with additional income or let them save income to achieve the work goal. So in other words, if a person has a work goal but there is a financial barrier to them reaching this goal, such as they need training or classes or uniforms or a vehicle or a computer, a person can write a PASS plan and potentially save some money to reach the work goal. And how it would work is, like I said, when you get an SSI payment, any income that you get causes that SSI to go down. So with a PASS, we would actually leave your SSI payment alone and let you save the money that would typically make the SSI go down, put it into a bank account, and use it to obtain goods and services needed to reach the work goal. So PASS is really for someone who has a job goal in mind, whose disability would not impair them enough to not reach the job goal. And Social Security does ask that Mass Health, or Mass Rehab rather, helps us with determining whether or not the job goal is feasible for the person. And PASS will allow the person to save some money, keep their SSI payment, take that countable income, save it, and the PASS specialist will determine what expenses and what things we're going to allow the person to use that extra money to buy. And again, I actually used to work for the PASS program, and it's a wonderful program. If the job goal is not reached, then that's okay. There's not going to be an overpayment. You don't need to pay that SSI money back as long as there was a good faith attempt to try and reach the job goal and follow the plan. The PASS specialist will work with the SSI recipient, make sure that they are saving the money, that they're keeping their receipts, and that they're reaching their milestones and following and doing the things that they said they were going to do regarding taking classes or trainings and things like that. So commonly I receive questions such as, why are you always not approved the first time? And I think I already discussed a little bit about, you know, a person comes into the Social Security office and maybe they do not have the medical sources in front of them. They don't know where their doctors are, what tests they had done, things like that. Well, by going online and having those disability reports done online, we're finding that a lot of people are getting approved far quicker than they had in the past. But some other ways that Social Security is improving the disability process is with this quick disability determination unit at the Massachusetts Disability Determination Services. Quick disability determinations, basically when you fill out the medical portion of the application, and there'll basically be trigger words like different prescriptions or tests or you know, your condition that you're listing as the disabling condition. And certain trigger words will automatically flag the case and go to a separate unit because it appears that the person may be able to be approved fairly quickly. And that's what a quick disability determination is. We also have something called compassionate allowances. Compassionate allowances started a few years ago, and compassionate allowances were certain conditions and impairments that if a person alleges having a certain impairment or condition that's on the compassionate allowance list, it will automatically go to an examiner. We will instantaneously verify that that is the condition that the person has been diagnosed with, and hopefully will get you approved immediately. It could be in less than a week. Compassionate allowances started at about 20 conditions, and just recently we are up to 200 different compassionate allowance decisions. And if you are curious to see what that list is, you can go to socialsecurity.gov and you can actually get the full list of compassionate allowances. We've increased our national hearing centers. We've hired new judges. Like I said, it still does take, at some cases, up to a year to get your hearing date, but it's still much better than it has been in the past. And again, we continue to make the website more user-friendly, and we're adding new tools and policy and pamphlets and lots of information on socialsecurity.gov that is very easily accessible, and you can file for retirement, Medicare, and Social Security disability right online. If you want more information also about Social Security or SSI work incentives, you can go to socialsecurity.gov, click on SSI or Social Security disability, and you can read more about work incentives there. The most recent addition to Social Security's website is the My Social Security account. A lot of times people are asking me, whatever happened to those Social Security statements, those things you got in the mail right around your birthday? Well, they stopped mailing, Social Security stopped mailing those out to absolutely everyone. Now they're only mailing them out to folks who are age 60 and older, so approaching retirement. So I just wanted to make sure that you know that you can go to mysocialsecurity.gov and create a secure account with a login and password, and that is how you can get your Social Security statement, is right online. It looks exactly the way that it did when it used to come in the mail, but it gives you lots of good information about your earnings and your payment information. So I highly recommend that everybody go to My Social Security and create your account so you can see that information, because it is important for all of us to know what to expect as far as Social Security, retirement, and disability benefits. Once a person gets on the rolls for Social Security, if they have a My Social Security account, they will be able to check their benefit payment information, update their earnings record, change your address and phone number, or start and change direct deposit. It's important to note also that direct deposit is mandatory. That just is effective in March of 2013. Officially, everybody had to switch over at that point. So if you need to update the direct deposit information, you can do it at My Social Security. The important thing to note is that the My Social Security account is intended only for the person who is receiving a payment. So if you are a parent and you are going to be the representative payee for your child who is getting Social Security or SSI, you know, they are the person that is supposed to have this account. It is not intended for you to put your email address and create an account on behalf of your child. Hopefully in the future that will change, but as it stands right now, it is intended for the person who is receiving the SSI or Social Security payment. The really nice thing about My Social Security, if you can create the account, is getting the online benefit verification letter. The benefit verification letters, historically, you have to go into the Social Security office, possibly wait in line for a while, or you have to call and have that mailed home. Now the Social Security or SSI benefit verification letters can be printed right at home with the My Social Security account. So that's really exciting news for Social Security, and just an example of how we are improving our website at socialsecurity.gov. The benefit verification letters a lot of times are needed to get additional assistance, like assisted housing or a loan or mortgage. The letter actually talks about Medicare and mass health coverage. The retirement and disability status talks about verification of age and things like that. So benefit verifications is a huge workload at Social Security. People need them for a variety of different reasons, and you can get those now at My Social Security once you create your account. Here's our website, socialsecurity.gov. Here's the 1-800 number. A few other things I do want to mention that was not in my presentation that I know a lot of people have questions about is if you become a representative payee, Social Security is going to ask you to account for the money that you received on behalf of either your child or whoever you're representative payee for. You can complete these representative payee accounting forms right online, and they really are the best method for completing these forms. It typically is very easy to access it, to see your form. You need to have the paper form in front of you. We will mail it to you, and then you can just go online. But the nice thing is that you get an automatic receipt that you did what you had to do. And annually, Social Security is going to ask you, as a representative payee, to tell us how you've been spending the money on behalf of the individual. Last but not least, SSI wage reporting is becoming much easier. For SSI, it's very important that wages are being reported for SSI and Social Security because, like we talked about, the SSI payment is reduced based on how much a person is making. It's not reduced dollar for dollar, and as we saw, it is beneficial for an SSI recipient to continue to work. However, wage reporting in the past has caused a lot of overpayments, either because folks were mailing their pay stubs and one was missing, so we were unable to adjust the SSI check on time, or maybe they weren't reporting that they were working at all, and we should have been adjusting their SSI to make up for that work. Well, SSI wage reporting can actually be done right on a telephone number. It's called telephone wage reporting, and you can go to socialsecurity.gov, and you can actually get the telephone number and a little calendar that shows you when in the month you need to call and report the wages. You still will need to have the information right in front of you as far as gross earnings and week ending dates and things like that, but it is very easy to call this number. Usually it's between the first week of the month and you're reporting for the month prior. So the first week of May, you would be reporting for April's income, and it automatically will post to the person's record instantaneously, and it is proving to reduce the rate of overpayment that we are seeing from folks that do go back to work. The way that SSI works also, there's a cushion to prevent overpayments. So a person's SSI check for this month is actually reflecting what the situation was 2 months ago. So if you were reporting wages on time, it gives Social Security and SSI plenty of time to go in, update the record, and make sure that you are getting your SSI check in the correct amount to prevent any overpayment. So that is telephone wage reporting, and just recently we also have mobile wage reporting. Sometimes folks are unable to use the telephone wage reporting system either because of their disability or speech impediment or something like that, and they can actually, there's a new application that you can put on your phone to report your wages via the telephone and smartphone. So I just wanted to make mention of that. If you have any other questions regarding work incentives and going back to work, you can visit the website at socialsecurity.gov. And now I think we're going to open it up for questions.
Yes, we do have some questions, and if anybody else has questions, you can type them in now and we will go through them. Our first question is, I'm not even sure if you can answer this for us, but we'll try. My son is 11 and has diagnoses of autism, seizure disorder, severe allergies, and asthma. I applied for SSI for him, and he was denied because we have more than $2,000 in assets. But I am sure he's entitled to some funding due to his disabilities. I was told he can't get SSDI because he hasn't worked. Are there other options? And I did not appeal within 60 days. Should I reapply?
Okay. For a child, so they're under age 18, they are looking at the income and assets of the parent. So if you have income and assets that are over the amounts that we talked about, $5,000 if it's a two-parent household, $4,000 if it's a one-parent household, then they are not eligible for SSI, and we are not even going to send it to the Disability Determination Services to get a medical decision. Because in order to become eligible for SSI, first and foremost, you need to have met the income and asset criteria for the program. So that would probably be the reason, but my advice to you is to wait until your child is approaching age 18, because at that point, your income and assets will not count as far as the SSI. We would only be looking at their income and assets. So as far as Social Security disability insurance, you're right. If they have not worked and they have not paid into Social Security, they will not be eligible. However, if you or the parents of the child become entitled to Social Security retirement or disability because of your work, at that point, if we can find this child disabled before they reach the age of 22, they could potentially get benefit from your Social Security earnings, and that's that disabled adult child benefit.
Okay, thank you. Our next question. My daughter gets SSI payments that go up and down monthly. She's unable to work and is 19. Why does this happen?
Does she can I ask, does she receive any other income? The SSI payments would typically only fluctuate if there's other income involved, like wages. For example, if you're working and one month you get $500, the next month you get $600, the SSI payment is going to fluctuate. But is there other income?
Yes, she gets Social Security from my role.
Okay, so she gets Social Security benefits and SSI. So Social Security is counted a little bit different than wages. Social Security, or what we call unearned income in any fashion, whether it be child support or unemployment or a pension or anything, when it comes to SSI, it's counted almost dollar for dollar. So it shouldn't really fluctuate. If they get $200 a month from you, then $180 would be coming off the SSI. We basically count it dollar for dollar. We take the amount We subtract 20, and whatever's remaining is what comes off that SSI amount of $710. But typically, it would only be dependent on what income she's receiving. That is what would cause an SSI payment to fluctuate.
And in this case, the parent is disabled as well, so maybe her income is fluctuating.
Correct. If the parent is disabled as well, or the parent is working and the wages are changing, that income also reflects the SSI payment. So any income, whether it be if it's a child and we're looking at parents, we'd be looking at the parent's income, that would cause the SSI amount to fluctuate. And income for the child would cause the SSI payment to fluctuate.
Okay, are there any other questions? Okay, thank you for joining us, and I will be sending out the PowerPoint to everybody who has sent their email, and everybody who is registered will be getting the PowerPoint within the next couple of days. Thank you again.